Hello, my name is Marissa Murphy, and I am part of the Arnold Palmer Hospital for Children. And today we will be talking not only about our organization, but also why we have decided to create this podcast. So, to introduce myself, I am a current employee for Strategic Visions, and it is my job to um, create and implement a new um, comprehensive patient care program. Now, with that being said, what is patient care programs? Well, patient-centered care programs basically develops um, a direct contact between doctors, organizations, and patients to make it more cohesive in order for patients to not only feel like they are a part of the decision making, but also to include them in the recovery. So basically, what it is it's going to be more engagement on the patient side, more communication between the doctors and their patients, and for doctors to understand the patients more rather than just assessing and giving them health regimens. So at the Arnold Palmer uh, Hospital for Children, we have developed a program that's going to implement this patient-centered care in order for children to receive the best benefits and to help make them feel heard and understood. Um, so that is our development for the podcast. The Arnold Palmer Hospital for Children is located in Orlando, Florida, and is a not-for-profit organization. It has over 30 specialties to ensure the health and well-being of children that visit the hospital. We have access to a level 1 emergency department and trauma center. The hospital is ready to handle any situation, including performing complex surgical procedures and treat children who have been diagnosed with any severe traumatic injuries, burns, near drownings. We have a pediatric intensive care unit and a pediatric special care unit, which has increased since we've opened in 1983. By using the patient-centered care facilities, the outcome of the patient's health will and is expected to exceed all expectations and increase and improve the well-being of the patient because it's surrounding their health care and making them a part of the decision. For the Arnold Palmer Hospital for Children, we want to ensure that their care is at the highest priority. It is our mission of the hospital to provide the superior care to children that are in critical or serious condition by taking all the measures for the child and making sure that the communication with the parents, caregiver, so we develop that family-centered healthcare. We want to integrate all aspects of healthcare into the decision making through education, various practices, research, and consultation. Some of our forward thinking that we want to include in our hospital is creating scenarios for children in the Bill of Rights, what we call it, to ensure that the child is the center and everyone is working around them rather than leaving them out. We want to advocate for our patients and start the direct communication to show respect and to make sure that the medical staff is using language for the child and the family so that as everyone is completely understanding the situation and it makes them all on the same page. The level of care that we want to provide at our hospital is so that when the primary care for a safety net hospital such as ourselves were ever to be impacted by a health epidemic, it typically impacts the minority population, the poor, the uninsured, and those living in underserved communities. We want to be part of the change, and we want to develop a hospital that will take care and not turn away anyone that doesn't have that insurance that they are being taken care of, especially since they are children and we specialize in children care. We want to make sure that this primary care and the safety net when it comes to epidemics will be federally qualified in health centers, and making sure that we're more of the public hospital that will be able to not only treat vulnerable populations, but also provide health care and be able to take care of the capacity surge to prevent overwhelming our hospital and our emergency departments. Thank you for tuning into our first podcast today. As we continue talking about our hospital and talking about our patient-centered care programs and talking about how it will affect a health epidemic, we'll get more into policies and the way that we want to structure our hospital and how communication with doctors, and hopefully we'll have some guests come along on the podcast to really talk about the changes and the experiences that they've had here at other hospitals. So please stay tuned for next week's episode, so that way we can continue the discussion, continue to improve, and hear the voices of our patients. Thank you.